Our brain sends messages to all parts of the body, telling them how to work, what to do, and what not to do. Millions of tiny electrical signals carry these messages. What is seizure? A seizure happens when there is an extra burst of these signals in the brain. Recurrent seizure could be a serious condition. More than one seizure usually means a condition called epilepsy. What causes seizures? Some of the possible causes are brain infection, signs and symptoms of seizures. Here are some signs that you might be having a seizure. Getting a funny taste in your mouth. Having a strange feeling in your tummy. Going stiff, then falling to the floor and jerking. Staring into space for a few moments. People might think you're daydreaming. An arm or leg may suddenly move on its own. What happens during seizures? During a seizure, the person may pass out or shake all over, may not be able to respond. The muscles may tighten and relax rapidly or stop moving completely. Seizures are usually very short and last for just a few seconds to minutes. Types of seizures. There are different kinds of seizures. Seizures are classified based on the extent of the brain involved and also on duration of seizure activity. Partial seizures. Seizure activity is limited to one part of the brain. Generalized seizures. Seizure activity involves whole brain. Continuous seizures. Repeated seizures without recovery between them. Partial seizure. Simple partial seizures. Consciousness is not impaired, limited to one part of the brain. During partial seizures, a person may experience sudden joy or sadness, or sensations of smell, hearing, or vision. Complex partial seizures. Consciousness is impaired. Person may exhibit abnormal repetitive behavior like blinking, moving in a circle, striking out at walls, or moving an arm or leg uncontrollably. Secondarily generalized seizure. Seizure activity spreads to both sides of the brain after it has started at one part of the brain. Seizures usually last no more than a few minutes. Generalized seizure. Generalized tonic-clonic seizure. Grand mal. The person will emit a short cry and fall. The muscles will jerk and twitch. Absence seizures. Petit mal. Person appears to be staring into space with eyes rolled upwards. Myoclonic seizures. Brief shock-like jerks of a muscle or a group of muscles. Atonic seizures. Drop attacks. Involve the loss of muscle tone, causing the person to fall to the ground. Continuous seizures. Repeated seizures without recovery between them. A fixed and enduring epileptic activity lasting for more than 30 minutes. Treating epilepsy. If you have a friend or family member with epilepsy, tell them it's okay and tell them not to worry, because there are medicines to help stop the seizures. Let's meet a doctor. Doctor, what are the treatment options for epilepsy? Treatment of epilepsy may include anti-epileptic medications, diet, and surgery. Medication. The doctor will find the right medication and dosage, considering many factors like frequency of seizure, age, and medical conditions, etc. Taking anti-seizure medications called anti-epileptic medication has helped many people become seizure-free. For many others, it has been successful in decreasing the frequency and intensity of their seizures. Diet and surgery. Ketogenic diet has helped reduce seizure for some children with epilepsy. It's a strict diet, high in fats and low in carbohydrates, where body breaks down fats instead of carbohydrates. The diet is specially designed by doctors and dietitians. For some people, if the medicines don't help, they may have to go for an operation or eat a special kind of diet called ketogenic diet. Thank you, doctor. Do's and don'ts activities. You're just like everybody else, who may or may not require help all the time. You can almost do all the things that others do on your own. Although you can live an independent life and almost do everything that others do, there are certain things you must take care of, like do not drive or ride. Instead, have someone drive you. Have company always, if possible, so that you can be cared for in case you have a seizure. If you go for a jog or walk and have no company, tell someone the time and track you will take. Avoid activities or sports that could really hurt you in case you have a seizure and fall. The doctor will tell you what those are. First aid. If you see someone having seizures and they have fallen down, try and get help as quickly as you can. If you can't get help right away, here are some do's and don'ts to help meanwhile. Do's. Keep calm. Time the seizure. Cushion their head with a pillow or jacket. Loosen any tight clothing or neckwear, belt, necktie, or other tight clothing. Remove the spectacles if they have one. Clear away any sharp or hard objects. Roll the person onto their side. This will help them to breathe. If you have a mobile phone, call for an ambulance or hospital. Stay with them until they wake up. Don'ts. Do not panic. Do not insert spoon or anything into the mouth. Do not try to hold, as they may get hurt. Do not try to put a gag in mouth, it may cause difficulty in breathing. Do not crowd around the patient. Don't give them anything to eat or drink. It may choke them. Remember, it's up to you to decide whether you want to tell your friends about your epilepsy or not. But it's a good idea to let them know, so they'll know how to help you in case you might have a seizure when you're with them. Treat epilepsy as any other medical condition, just like some people have breathing problem because of asthma sometimes, or someone needs glasses to see better. People with epilepsy are normal and healthy otherwise and need little help from the doctors. People with epilepsy might feel different because they have seizures, but remember, they are normal just like you. So treat them good and make them feel comfortable and safe. Information for the caregiver. If you're a caregiver to someone with epilepsy, be absolutely supportive. You cannot catch epilepsy from anyone, and they can't pass it on to you. Your support and encouragement will give them the confidence to go about everything. Ensure you know all about the medicines, dosage, and other instructions, and ensure the medicines are taken every day. Maintain a seizure diary and write down all that happens before, if possible, during, and after the person experiences a seizure each time. Record and take pictures with your mobile phone when they are having a seizure. It can help the doctor choose the right medicine and treat the epilepsy in a much better way. Take care of yourself too, and do not neglect your own health.